the Early Career Researcher Programme. My name's Emily, I'm Research Comms Manager, and I'm covering for Sam Laws today, who unfortunately can't join us. So hopefully you all know a bit about us already, but for those of you who haven't previously spoken with Zoe or I, the aim of this programme is to kind of work alongside our traditional grants and support programme by providing the additional support and training where we can for people who are at a relatively early stage in their career. And that's stuff that we are aware of, but also things that have been identified by you and everyone we're working with in this area. So please do continue to send those ideas and needs into us. So the idea behind this programme is, although we are a grant funder and we're here to support the science, our investment in the science is bigger than that. Our investment is in the people who are doing it in their careers and ultimately in the future of renal medicine. And we want to make sure that's happening. This is something we can't do on our own. We don't want to do on our own. We are aware of some other really big and great initiatives supporting early career researchers. We'd encourage these people to work with us. And if you know of anyone else in this area who's interested, send them our way rather. So throughout this year, we'll be holding a series of events looking at building skills and kind of developing initiatives and ideas in this area. This is the first one, but we also have a networking group available on Facebook. Please do contact Zoe if you want to be a part of that. That's just to provide more support in this area. So our first speaker today is Mae. Mae is our patient involvement manager. I've also forgotten housekeeping, which will come to a minute, and she'll be talking to you about her role in making sure the patient voice is central to everything we do. Before I hand over to her, I'll just go through the housekeeping. We do really strongly invite your questions. Please put them in the chat. Any that we can answer as we go along easily, we will do. And then at the end, there'll be time for Mae and Ben to answer. The other thing to mention is we're recording this meeting. So on that, I'm going to hand over to Mae, our Patient and Public Involvement Manager.
Thanks, Emily. Afternoon, everyone. Thank you for joining our webinar, the first one on PPI, which is obviously our favourite topic. And this is kind of a whistle-stop tour on what PPI or patient involvement and engagement is for those that haven't come across it before, what we can do to support you in your PPI journey and kind of the benefits it can bring. And we've got a short video from a patient as well. So it's a very whistle-stop tour, but we're here to support you as a charity in your PPI work. So do feel free to reach out afterwards if things don't make sense or you want a bit more information. So kicking things off, on the next slide, we've got a visual of how we describe patient involvement versus patient engagement. And this actually came from one of our volunteers, Miranda, so you might have seen this pop up at one of our conferences before. And this kind of explains what we as a charity mean by involvement versus engagement. So patient involvement for us is that patients are actually involved in the research study themselves, not as a participant, but sort of on the project team. So that might be they're a co-investigator or a co-applicant on the project, or they're on the research team attending sort of committee meetings and things like that. And they sit around that table with researchers at every opportunity. And what we do a lot more of is what we describe as patient engagement. And this is almost what Miranda describes as sort of your chips on the side of your burger meal. So you're not involved in the actual research committee, but you're sort of on the side feeding in. Some would say the more important part of the meal. And this is more of a sort of consultation process. You know, we go out to patients to ask for feedback, for thoughts on research studies, on research topics, research design. And I'll go into a bit more detail about how we do that later. And then research participation is patients actually being involved in the study itself when it's put live. So I won't go through all of this, but this is a bit of a snapshot of patients can actually be involved in the research cycle from the very start until the very end in completely different ways, and different patients will be more interested in different parts of the research cycle. So right at the start, obviously, when researchers are trying to even choose what they're looking to research, patients can be involved in that by identifying what gaps are missing in research. You know, what is one of the biggest problems that kidney patients face that isn't being researched at the minute or hasn't changed in 20, 30 years and actually is really important to patients. So we run, workshops to try and figure out what patients want us to look into. Research design, which is a lot where we come in with a lot of researchers, is helping applicants sort of chat to patients about their design, whether it's in really early stages or it's moving along sort of towards the proposal going in. Patients can look at that from an angle that, professionals can't always do, and see if it's easy for them to take part in. Is there any major barriers to patients taking part? Have they involved patients the right way so far? And they use their lived experience to inform the applicant on whether it's potentially going to be a success or not. And we do a lot of this at Kidney Research UK, and it's probably where we speak to the most researchers within our team. But it doesn't stop there. As the study goes on and progresses, or the study comes to a close and the results are being published, patients can also help with that, with interpreting results. Why is this happening, what it means from a lived experience perspective. They can share results out with their kidney networks. They can help promote studies to help with recruitment. So this is kind of a snapshot that patients can be involved at any opportunity, and it's really valuable to hear their lived experience at all points. And then some of the benefits. I mean, we think they're quite obvious benefits, but for those that have never done it before, it can be quite sort of hard to understand why you need to involve patients. But as it says here, it checks the relevant, and it makes sure your research has context to it and is going to work. Some people might put in a huge study, and actually it's asking so much of patients on top of their already treatment that's a huge burden in their life, or the 100 appointments they go to a year, and actually they're all going to say we just wouldn't commit to it. And there's no point your study going live if patients aren't going to commit to it. So it gives that context to your work and to the practicalities of it. Again, it enables you to focus on areas that are actually going to be beneficial to patients and what patients want to change. It's easy for medical professionals to think they know what a patient would want changed about their treatment or their lifestyle or their transplant, but actually hearing from patients will ensure that researchers are choosing topics that are ultimately going to benefit patients. As I said before, it brings improvements to the design, and it raises awareness of your research in the kidney community. We share a lot of studies with our kidney network to take part in, but they also go on to share them with their networks. So it's just pushing your research out to the kidney community. And as we always say, some days when people are, whether you're in the lab doing lab-based work and you don't get any communication with patients, sometimes it's easy to just do your day-to-day, but actually speaking to patients, it provides you with the context of why actually we're doing what we're doing. And it's the same for us at the charity. We have patients come in and talk to us, and it just really drives home that importance of actually what the work we're doing every day. So this is a little bit about how you can involve patients, and this is just a snapshot of some of the ways you can do it and how we can support you with that. But we do tailor our support to whatever needs you have as a researcher. So again, as I've already said, it will help you to prioritise your questions. They can review your lay summary before it goes in for a bid. So a lot of researchers will ask for patients to look at their lay summary before they apply for funding, either from us or from big funding bodies. They get patients to look at their method. Like I said earlier, actually, is it too much for patients? Does it make sense to patients? Would they actually take part in it, or is it too burdensome? And actually, some researchers change a lot of their methodology based on these conversations. And as I've said, it motivates you and lets you talk about the benefit your work could bring to patients to provide that bit of hope. So some of the ways we do it on the right, and again, it's not limited to this. We often facilitate small focus groups, and actually depends on whether you want us to facilitate it with you or just find patients for you to do it on your own. We support you all the way through. We can share your surveys or your studies with our patient network to find people to take part. If it's kind of small tweaks, we can do sort of email exchange feedback where we send stuff out to patients to read, whether that's a lay summary or something, and they send us feedback which we collate for you. And again, one-on-one calls or events just to come and meet our patients are always beneficial, and we try and get patients at events where we know you're going to be, to sort of provide the easy opportunity. So this is a little video from one of our patients called Catherine. She talks a little bit about being one of our volunteer roles, which has actually sadly come to an end, but you get the context of what she was doing in that role. She was a research network volunteer that reviewed our application. So we do have a similar role still, but it's slightly different to what she talks about. But she also talks about being part of a conversation with a researcher to talk about his study and what it meant as a patient. So I'll let Catherine, the patient, do a lot of the talking.
Catherine,
I think that explains quite nicely how not only is it beneficial for researchers for us to involve patients in work, but actually it's beneficial for the patients too. They might not be the ones doing the research, but actually seeing the research that's going on behind closed doors gives them hope and provides them a bit of light at the end of the tunnel if they're living quite a dark journey with kidney disease. So it's beneficial for patients as well as researchers, which is why we try and push it where we can. And that's the end. So hopefully that gives you a little bit of insight. Some of it you might already know, and some of you might be new to PPI, but we're here as a charity to support you. There's 2 of us who support research of the PPI. So if you do have any questions or you want to chat about how you can involve patients in your work, if you're very early, you just want to learn a bit more, then do feel free to reach out. We can share I think my email address is shared later on, but if not, we can send it out after. Yeah.
Fantastic. Thank you very much, Mae. Please do put any questions in the chat or we can pick them up later. I'm going to hand over now to Ben. Ben joined us, I think, about 6 months ago, and he is in the research ops team working with Elaine and Sam, who many of you will know. So he is going to talk about the kind of expectation and what we would like to see regarding patient involvement in your grant applications.
Thank you very much, Emily, and thank you, Mae. So yes, my name's Ben, and I'm going to talk to you about how you can involve patients in your grants and sort of give you some top tips of what to include in a grant application in terms of patient involvement and engagement for that application to be funded. Okay. So firstly, Mae gave on her slides a really nice overview of how patients can be involved in every step of that grant, and I'm going to give you some examples of how here. So patients can be involved in your grant even before it's started. They can help you to frame your research questions. They can help you spot gaps in current treatments. They can be part of research advisory groups and steering groups to help inform, your research study, what it's on and how it's designed. And that can be done before your grant starts, but also during the course of your grant. One way we find patients can really help our researchers is by helping them work on plain English research summaries. It's a really important skill for you to develop in your career as a researcher, the ability to communicate your science, not just to other scientists, but to patients and the general public. Plain English research summaries or layman summaries are a good way to do that, and patients can really help you do that. And we'll come back to those summaries later. Patients can help contribute to your grant applications. A lot of your grants and projects require ethical approval, and we have examples where patients can help researchers complete regulatory submissions or even in some cases attend research ethics committee meetings. Patients can even act as co-investigator and collaborators on research grants, and depending on the nature of your study, they may be actually involved in performing the research. They can help run focus groups, or if you're doing a study that's involving collecting patient data, patient questionnaires, then that's something that another patient can help with. And Mae touched on this earlier, is a key way in which patients can also help is helping recruitment for your study. Driving recruitment can be quite challenging in some cases. Patients can help you develop patient information sheets, consent forms, so that patients can understand the study, make an informed decision, and ultimately participate. And even during your grant and once your grant is finished, patients can really help disseminate the results of your studies. And that can be by presenting at conferences or also via their own social media. We find patients can sort of reach places that researchers sometimes cannot. And one way in which that's happening that we're seeing become increasingly common is through joint presentations. So what I mean by that is examples of where at a conference, a researcher might present the first half of the talk on the science and the details of the research, and then they invite a patient up who will speak for the second half of the talk, really highlighting how that research is affecting them and their kidney condition. Okay, so how do we actually achieve effective patient involvement? Patients can help us in all of those ways, but how do we make sure that that involvement and engagement is effective? Well, you have to involve enough patients to provide a breadth and depth of views. The right number of people to involve is very difficult to quantify, but it should almost always be more than one. One person's views are not going to sort of represent, a whole group of kidney patients. So it's really important that you try and include as diverse range of voices around the table as possible. So you need to think really carefully how you're going to involve patients with diverse backgrounds and experiences. And I include in that, diversity of gender, ethnicity, religion, and also people's experience of kidney disease can be different. You want to try and capture the full range of experiences in your patient voice. Another thing to bear in mind as a researcher is that you're going to be working with patients that have a range of scientific abilities, and a good skill for you to develop is the ability to pitch your research and change your pitch depending on the scientific ability level of the patients. Many of our patients have not studied science since high school. Other patients perhaps have scientific degrees. Many of them might work in research or the pharmaceutical sector, and they're going to understand really all the sort of scientific details underpinning your research. It's really important that you can pitch your research accordingly. And one last thing to bear in mind is that not all patients have to be involved in your grant in the same way. Some people may have a high level of involvement. They could even be members of your research team. Others might just complete surveys asking them about their priorities and how you can use that to inform your research study. So how do we find these patients? How do we find excellent patients like Catherine? Well, here are some resources. So the People in Research website allows patients to search for opportunities to be involved in research, and also for researchers to advertise opportunities for patients to get involved. So there's a good website there. We have some other websites that are more localised. So if you're in Wales, the Health and Care Research Wales Public Involvement Team have a resource there. For Scotland, the NHS Scotland Chief Scientist Office also have a resource that can be found at the web address there. And both of those are aiming to increase involvement of the public and patients with research. And remember, we as a charity are also here to help you. We can help run small focus groups, and we run patient-centred events. So we can help put you in touch with patients, and Mae can help with that. Her email address is here. So what I want to do now in the sort of second half of this is really go through some sort of top tips. What do we want to see in a grant application in terms of the patient involvement side of things that will give you a higher chance of that grant application being successful? So at Kidney Research UK, we are committed to improving outcomes for kidney patients. Accordingly, we're looking to fund applications that show the greatest potential in improving experiences for kidney disease patients. So successful applications should be written in a way that focus on the needs of patients. They need to make it clear what are the potential benefits of the research on patients. Remember, we do fund proposals that do not necessarily have immediate short-term patient impact. We strongly encourage basic science applications, but you absolutely must include in your application an explanation of what is the long-term vision for improving patient outcomes. As long as that vision is there as to what is the effect of or potential effect of your research on patients, the time scale of that, we are less concerned about, as long as you explain how it can be beneficial to patients. Another absolute must for us is we want to see non-participant patient involvement in your grants where researchers are engaging with patients. So what I mean by this non-participant patient involvement, I'm not talking about patients involved, in your grant as a cohort study, if you're testing drugs on a patient, or patients are providing you with biopsy samples or blood serum samples. I'm talking about patients being involved and engaged in the ways that Mae and I have spoken about already. We want to see patients involved as a voice around the table with researchers during the entire life cycle of your grant. So we're looking for evidence of that in your grant application. So some no-nos: grant applications that treat patient involvement as a sort of tokenistic checkbox exercise are unlikely to be successful. In your grant application, we ask you questions around patient involvement. Please give as detailed and as specific answers as possible. So for example, if you say, yes, we're going to listen to the voices of patients, or we're going to run a workshop for patients, these are too vague. We want some specifics. If you're going to run a workshop, well, how are you going to find the patients? How many patients? What kind of condition are they going to have? We want some details and specifics about how those patients are going to have a voice in your research. Something to bear in mind is that we have always involved patients in decisions around which applications that we fund, but how we do this is changing slightly. So we are going to have patient committees that meet to discuss grant applications, and they are going to consider the following things: the importance of your research topic, how important is that research to patients, what are its potential benefits, and also the level of patient involvement in the grant. And as part of that, patients are going to be asked to score and comment on a lay summary of your research that you will provide in your application. And these patient committees are going to meet around the same time as, but separately, to scientific committees. And those scientific committees will involve sort of discussion of the more scientific aspects of your proposal. We take just as seriously comments from our patients as we do from sort of our scientific panels as well. So it's really important that your grant is scored highly by patients as well as expert review scientists as well. So some tips then on how to score highly on our patient committees. So your layperson summaries absolutely must be understandable by patients with non-scientific backgrounds. So the don't that is paired with that, patients are unlikely to recommend for funding applications where the lay summary is too detailed. It's really obvious to us which funding applications have involved patients, and this comes back to what I was telling you a few slides ago, how patients can help you write your lay summary and be involved with your grant submission. If you show your lay summary to patients first and it's well received, then it's likely to be well received when we show it to patients. It's very obvious to us which grants haven't had patient impact in their lay summaries. You need to set your research into context. Why is it important and what are its potential benefits to patients? They should be clear. Applications where the primary focus is to enhance the reputation of researchers or institutions or to lengthen researchers' publication lists are unlikely to be highly scored by patients. They are all important outcomes of a grant, but they are not going to be the main focus to patients. So applications need to highlight how the research really could improve outcomes for patients. Okay. So as a reminder, we have grant rounds open now for applications. You can find more details at our website. The link is there. We have other grants rounds opening later in the year, but those ones are the ones that are open now. We run a range of, within each grants round, different types of grants. We do PhD project funding all the way up to full research projects for established academics. We offer tailored grants that sit between those for early career researchers. So we offer a range of different types of fellowships. Again, the details of those are on our website. If you have any questions about whether you match the criteria or any questions or need help applying, email our grants@kidneyresearchuk.org email address. Remember, for each of these different types of grants and grants rounds, we want to see patient involvement in all of them. Thank you very much.
Fantastic. Thank you very much, Ben. Just for the couple of people who I think joined a bit late, thank you for joining us today. Anything that you might have missed, this webinar has been recorded and Zoe will circulate it afterwards. And as I said earlier, this is the first in our kind of ongoing programme of webinars. The next one is going to be at our in-person event, which is Driving Discoveries. This year, thank you, Zoe, it's in Bristol, 24th, 25th of September. We would love to see you all there. You do not need to be Kidney Research UK funded to attend this meeting. It's anyone who's got an interest in making a difference and being involved in this area. We are still working on the programme for the early career bit, but it will be looking at translation. So what support can we offer and what are we looking for to make sure that from the very earliest piece of research, we're thinking about that patient benefit and how to bring it to the clinic. The other thing that I can just share with you very quickly at this point, before I ask if you've got any questions, is that we do have agreement in principle now to provide bursaries for travel for scientific meetings for next year. That is to allow people to go and present their Kidney Research UK kind of primarily funded research at the big meetings. And we know that with Kidney Week and ERA going on next year in close proximity, that will probably be something that people are looking for. Once we have all the admin set up, we'll make a proper announcement on that. But we just wanted to share that that will come online, but not for driving discoveries, I don't think, at this point. We are just going to very quickly hand over to Chloe, I think, first to talk about the fan network as well.
Thank you very much. Great talk, and thank you just for giving me the opportunity to promote the fan club. So I'm Chloe. I'm a nephrology clinical research fellow based up in Liverpool at Alder Children's Hospital. And myself, along with Louise Oney and Becky Preston from Manchester, have created this fan club, which is the Future Academic Nephrology Fan Club. Sorry. And this is essentially sort of still in its early stages, but the aim of what we're doing is to try and create a bit of an initiative alongside the British Association of Paediatric Nephrology and also the LifeArc Kidney Research UK ecosystem to promote sort of engagement with research in clinical trainees and sort of create a bit of a virtual network between us to give opportunities for collaboration, so we can share research ideas and grant opportunities and things like that. So it was just to give a bit of promotion. So currently we have just opened to paediatricians or people interested in paediatric nephrology, but we're trying to understand whether there would be interest from adult nephrologists to join, because I think that link between adult and paediatric communities within the nephrology world would be really good, and then also non-clinicians as well. And I think it would be, you know, really good to hear from other people whether or not you'd find that useful as a community to join. Hopefully we'll be able to meet in person for the first time at Driving Discoveries. So I'll put a link to our website in the chat and our email address as well. If you're interested, just drop us an email and we can see how we can kind of expand and move things forward.
Fantastic. Thank you, Chloe. And I think Zoe is going to talk on Laura's behalf about the Lab Scientist programme.
Yeah, hi everyone. So I'm just going to speak on behalf of Laura Denby. There's a new laboratory scientist research committee group that she's working to set up, which is going to become a professional group as part of the UKKA. So I just wanted to highlight here that this is going to be coming in the future alongside the initiatives that they've already got set up involving the SPR Club and Network, which is more for clinical scientists. We're really keen to support lab scientists and non-clinical early career researchers as well, and make sure they've got the opportunities to, you know, attend the same sort of networking events, to reach out and engage with different skills that they might need, and just, you know, build a bit of a community there, and make sure that the lab scientists are involved with everything that's going on at the UKKA. So there'll be an official announcement with more details and stuff on the website coming soon. So I will circulate that through emails and on the Facebook group as well. So it's a little bit of a watch this space. Any questions, if you want to be involved with sort of setting up the committee or taking more of an active role in that, let me know, because I know Laura Denby is keen to get as many ECRs involved as possible and help them on their journey. Thanks, Emily.
Fantastic. I'm looking at the chat and I don't think we've got any questions in. If you do have any ideas, if you need any support, if there's anything you want to raise at all, get in touch with Zoe and I at the Careers Development email, or contact us on my email or Research Comms. We are really keen to work with everyone, and we're keen to learn from you what it is that you need and how we can help you. Otherwise, unless I've forgotten anything, I think that's probably everything from us today. So again, thank you so much for joining us. We're really glad that you are interested in our programme, and we hope it's been of some help. We also very much hope to see you at Driving Discoveries or any subsequent events that we put on, and we will share full details of those in due course. I think, yeah, that's it from us. Otherwise, thank you very much.
Thank you for joining, everyone.
Thank you so much.